Good morning, everyone. Dr. Fantastic here. We are doing a double cast. This is a podcast, Dr. Fantastic Interviews, and we're doing the YouTube show, Fantastic Interviews. And I'm happy to be with Dr. Robert Henderson. He is my uncle, and he has got a lot of great things to share with y'all today. We're going to have a fun conversation with Bob. And the first I'd like to tell you is that he is a radiologist from USC, correct?
And an internist.
And an internist.
Yes.
And you were telling me some harrowing stories about being on the... When you first started, you were in what?
Internal medicine.
And tell me some stories about that.
Oh, the stories are all pretty unpleasant, so I think I'd shy away from that.
But you learn, we were talking about, this terrible thing that's happening now.
Well, you learn how to take care of patients,
right?
For sure, because you're the only one. It's a resident-run hospital, L.A. County.
Right.
At the time, the biggest hospital in the country.
Really?
Yes. Anyway, it was a great background, but I practiced radiology most of my life and nuclear medicine. But the internal medicine background made you very interested in past diseases and what you could learn from them. And what we learned from influenza epidemics is that there has never been, to my knowledge, a completely novel flu epidemic.
Well, this is the seventh one, COVID-19. I'm told it's the seventh novel one.
Well, they're novel, but like even in 1917, there had been an epidemic 30 years earlier, and so those people alive had some immunity to the virus that caused the Spanish flu. So it was not novel.
Mm.
The coronavirus, nobody in the world has ever been exposed to it before. So you have a naive population that is totally susceptible to the coronavirus.
And unprepared.
And if it happens again in 10, 15 years, there will be people who have at least some immunity to it. But it is really the only virus like this.
When did you first hear about it? I heard someone discovered it in the 70s, then I heard the 30s. So when did you hear about coronavirus itself?
Well, coronavirus wasn't... There's a family of coronaviruses,
right?
One of which causes a common flu type thing, but they don't have cross immunity. So this came from an animal, I think maybe bats.
The wet market in China.
Yes, exactly. And it's a novel coronavirus. It's like herpes. There's like 9 different herpes viruses, and they cause different illnesses. So this particular coronavirus, the entire world's population is vulnerable.
Well, I just heard today they said probably more than 70% of everyone on the planet will get it.
Well, I don't know about that, but if we're not careful, yeah, that will happen. China has an edge because they can just tell their people what to do, and they do it. We are a little freer in this country, and I'm happy for that, but it's going to be harder to isolate people in this country than it is in a dictatorship.
And the timing couldn't have been any worse. It came out during the Lunar New Year, where billions of Chinese are on the move, and it was like the perfect storm.
Yes. The thing is that even the Spanish flu, which, by the way, no proof that it originated in Spain. Spain wasn't a combatant in World War I, so they were free to publish information about it. 250,000 French people died from it, and you never heard a word about it because they were trying to defeat the Germans, and the very presence of all those young people who were totally unprotected, and there were no antibiotics and no respirators at the time, was a setup for having younger people be the ones most effective. And there might be some differences in the virus, but it's the only pandemic that predominantly affected younger patients. The coronavirus now affects mostly older patients, and particularly those with pre-existing conditions.
But if I'm not wrong, anyone can carry it and give it to someone else. Doesn't mean they're going to...
Absolutely.
And so what I don't like is they're saying everyone shouldn't be tested. Well, the president said anyone who's feeling good right now doesn't need to be tested.
That was a political decision.
Yeah, well, the thing is, just because you feel good doesn't mean you're not carrying it, right?
Absolutely, but it was a political decision because a panic-type reaction to it could influence the outcome of the 2020 election.
Yes, it's always political.
That's politics, and I don't want to get into that.
No, we don't talk politics on the show, but what I'm really happy about is people from all over the world that are following my movement, the Be Fantastic movement, are sending me information from the ground. You probably haven't watched my video from Bergamo, Italy. I have a doctor in the hospital, and he reported from firsthand view. No political bullshit. I'm reporting really good information like this right here. This is, you have nothing to lose or gain by telling me what you know, telling the audience what you know,
right,
and what they should know about this pandemic.
Well, it's not unique. I mean, it's not entirely unique. When I was an intern in 1972, we had a flu epidemic, but we had respirators, but we didn't have enough beds, and one of my residents had 15 patients on respirators in the hallway, which was not a...
Well, that's happening right now.
And
everywhere.
that's happening in Italy right now.
Yeah.
They overwhelmed the system because they were late getting started with the isolation. To some extent, the U.S. is doing a better job with that, and it doesn't seem like it, but it has been contained better in the United States than Italy, Iran, and other countries, China, of course. But
well, they have a tally board now. I saw in the news. Right. Every country's listed with how many they've got.
In the 14th century, you had the Black Plague, the bubonic plague. They didn't even know what caused it.
Right.
And it killed about the same number of people that the Spanish flu killed in 19...
It killed 75 million. Black Plague.
It was
a third of the population.
It was like between 24 and 34 million but they were all Europeans. There were no...
Right. But that's where the most society was.
There were no European people in the Western Hemisphere at the time.
Right.
So it was inherently limited.
You were tight in.
Right.
By the way, everybody, the Black Plague was courtesy of Pope Gregory the Ninth. And this guy thought that cats were the devil's worship. So he ordered everyone to kill all the cats because he was the leader, he was the Pope, the most powerful person in the land. So they obeyed him and they killed all the cats, all the little kitty cats, because he thought that it was the devil's worship. What happens when you kill all the cats? Because they were mostly free, they weren't indoor cats. The rats come out, with the rats, the fleas, and the bubonic plague. So courtesy of Pope Gregory the Ninth, he killed a third of the world. Thank you, may you rot in hell.
Yeah, and that shows a lot of ignorance. But on the other hand, in 1918, when the war was raging and the conditions were absolutely perfect for spreading a flu-like syndrome, they had discovered bacteria by then, but the viruses, you need an electron microscope, which didn't come along until much later. So they didn't know what they were dealing with. They just knew that they didn't have respirators and they didn't have antibiotics, so that when somebody started going into respiratory failure, they didn't have the tools to even give them a chance.
Right.
And so that 30 million people, I mean, that killed as many people in a couple of years as AIDS did in 24 years.
Yeah.
And it was really
Now,
horrific.
AIDS is a virus as well?
Yeah, it's a HIV virus, and it's not curable, but there's suppressive drugs, and now people can live a fairly normal life with HIV, even though it was 100% fatal when it started.
Right.
But the number of people who were exposed to it were limited.
Right.
It wasn't something you get from droplets in the air like coronavirus or the flu. It was spread primarily by blood. So it was people with blood transfusions. It was unhealthy anal sex practices, and so that was a fairly limited population.
Mm-hmm.
Whereas this thing is so contagious, more contagious than the flu that caused the Spanish flu.
Now, I'm getting a lot of information, and I've watched 100 hours, I think, of documentaries and newscasts on this. They still don't know how long it lasts on a surface. They're saying it's airborne now. Obviously, the reason you wear a mask is to stop touching